The coronavirus is dramatically disrupting life here in the U.S. However, just across the southern border, a migrant refugee camp in Matamoros, Mexico, is bracing for what could be a deadly outbreak. Texas Public Radio reports that more than 1,500 asylum seekers there are particularly vulnerable to the virus. They're exposed to the elements and have minimal access to basic hygiene products as their asylum claims unfold in U.S. immigration courts. With me now is Helen Perry. She's the Executive Director of Global Response Management nonprofit and an acute care nurse practitioner with the U.S. Army Reserves. And Paula Ramos, she's the former Deputy National Director of Hispanic Press for Hillary Clinton. I'm happy to see you both. Helen, your nonprofit has raised enough money to erect a 20-bed tent hospital in Matamoros. You're waiting for approval from Mexican authorities to bring in rapid COVID-19 tests. Talk to me about the importance of those tests in Matamoros.
Yeah, so I think when we're talking about, the population that we're working with, over the course of the last 6 months, over 50% of the patients that we've treated at our clinic have come to us for respiratory symptoms and fever. And so when you're talking about trying to have a clinical suspicion for COVID, they're very high. And, another 25% have GI symptoms. And we now know that there is a subset of patients infected with COVID who are presenting primarily with GI symptoms. And so, these individuals have, been exposed to extreme conditions for months on end. They're living in tents. They have limited access to clean drinking water. They have, their food supply is now, being disrupted because they're predominantly reliant on nonprofits in the United States to help facilitate that. And we need these tests. Currently, Mexico reports only 53 confirmed cases and 176 suspected. And I know that at our clinic alone in the last week, we have 5 suspected cases that we can't get testing for. So, when we're talking about pandemics and we're talking about, contagious diseases like this is not a one-man effort. This is a global effort, and we need to be working at this as a team, regardless of borders, regardless of nationalities. We need to be taking a team approach to this. And unless we get testing, we're really not going to be able to offer the kind of isolation and care that these patients need.
Paula, you were at these camps just a few weeks ago. What was your impression?
Well, first, I just think we have to understand why we're even talking about this. And it's important for the audience to know that what we're seeing at the border right now is a response to the Trump administration's Remain in Mexico policy, as you just mentioned, Alicia. Over a year ago, for more than a year ago, there have been 60,000 asylum seekers stranded at the border. As we speak, they are stranded at the border. And for months, they've been waiting for their right to claim asylum in the United States. That's why we're seeing what we're seeing. That's why we're seeing these images. And so when I was there in Matamoros, I was also in Juarez with the crew from Vice. The main question I had, as I met these families, as I met these children that were sick, as I saw with my own eyes how inhumane these conditions are, the main question I had then, and the same one I have now, is who is looking out for these people? Who is taking responsibility? Certainly the U.S. government is not. And so as we're talking about this, as Americans, as we're all dealing with this crisis, let's remember that those families, these images that we're seeing, those are mothers, those are children, those are fathers. They're people that have a right to claim asylum in the United States. And if it wasn't for people like Helen, and her clinic, literally no one else would be taking care of them.
Helen, I hear what Paula is saying, and at the same time, as well as I do, people are looking right now at their own lives. They are overwhelmed. There is the humanitarian case for this. What is the public health case for why this should matter?
So, like I said, this is not a one-man effort. We cannot find control of a pandemic if we are only one country is only doing the right thing. And so when we're talking about, you just got done talking about how Texas has an unprecedentedly low number of cases compared to everybody else, which leads us to this suspicion that they're probably under testing drastically. The same thing is true on the other side of the border. And when you're talking about, think about how much, transients goes back and forth across the border between, goods and services that go back and forth, people who work on both sides of the border. This is a global disease. It does not care whether you are Mexican, whether you're American, whether you're Guatemalan, Honduran, El Salvadorian. It doesn't care. And we need to take global health approaches to this that are sort of regardless of what's happening at the border. We need to be giving everybody the same quality of care. And I think until we do that, we're not going to find control of this.
Helen, thank you so much for joining us, pal. I want you to stay with us. Up next, Congress is working on getting help for those who are losing critical income amid this pandemic. We'll talk about the $2 trillion coronavirus stimulus package that may come with a few strings attached. I'll talk to Michigan Congressman Dan Kildee about the bill and when